We are joined for our monthly house call by Dr. Joe Servin, Mayo neurologist and host of WJCT's Saturday show and podcast, What's Health Got to Do with It? Good morning.
Hey, good morning, Anna. So good to see
It
you.
is so good to have you, Dr. Joe. We appreciate you being here, especially with the news that is coming out about this latest measles outbreak. Talk to us about what do we know? What is the latest that we know about the status of this outbreak?
It's doing what measles will typically do when it has an outbreak, which is it grows dramatically. We know that there are now more than several. I don't know the exact number at this moment, but certainly more than 100 cases up in Texas and bordering New Mexico. We know that there's been thankfully just one death. I say thankfully because there could be more. But what's heartbreaking and heart wrenching about all of this is 2 points. Number 1, it is completely preventable. We have a vaccine. This is a condition that was considered eradicated in the year 2000 in the US. We are not there right now, and the sad thing about this, it's growing in a population of people that have had declining vaccination rates.
You say it was eradicated or declared eradicated. Obviously, it still sort of exists. So, what does it mean when a disease like that's declared eradicated? And what happened between then and now?
Yeah, so the reality is it was declared eradicated in the United States, but it isn't eradicated in the world. And we are very connected to other parts. You could pick up a nonstop flight from not too far from here, Atlanta, to almost any part of the world that may have pockets of the condition. Here's the thing about measles that doctors and providers always get nervous about. It is literally one of the most contagious viruses that we know of, period. Um, it can linger in a person who has the virus, and let's say you have measles and you're in the room, and this always freaks me out. The air and the room are potentially contagious to anyone who goes in that room for up to 2 hours after the person has left the room because the thing is so contagious and hangs out in the air, it hangs out on the surfaces. The other thing to know is that I don't know if folks remember when we were in the COVID throes, people would talk about the R naught number. That is, for every person who has a condition, how many other people can it infect? It's a theoretical number. For flu, that's about one or two. That means for any infected person, you can infect one or two more. For measles, it's in somewhere in the theoretical range between 12 to 18 people per person with the condition. So it has this very dramatic way to spread because of the fact that the virus can come through the air on surfaces, and it's so contagious. And that's the thing you have to remember about it. And when it was eradicated, that's because we had good vaccination rates, and we weren't hearing cases where it was kind of breaking through. Now we're seeing more.
So, I mean, I guess doing the math, you say the last count that I saw was 159 cases. That was as of Tuesday. The CDC website is only reporting these every Friday, so we won't know until tomorrow
Right.
the most recent figures. But I think if you just do the math on that, 18 times 159, that's a big number. I was really surprised when you talk about the contagion, though. I saw a stat that said that if there's an infected child in a class of unvaccinated children, the infection rate is 90%.
Yes, and it goes back to just the fact of just why it's so just the virus has found a way to live in many different environments and surfaces. And if you're just talking about air in a classroom or something like that, it's very easy to jump to others. The other thing about measles that people forget, and this is a good reason we forget because we haven't had to deal with it, is the fact that how it presents at the beginning, it looks like a lot of other conditions. A dry cough, runny nose, maybe a fever.
Mm.
That's the beginning. But then if you take those 3, that's the beginning of everything.
Right, right,
So
right.
so it's very hard to distinguish it. Everyone thinks of the rash. The rash is the last part. It's the other stuff, the coughing and all the stuff that happens before it, that's when people are spreading the bug, and that's why it's very easy to kinda make it spread, and when you have a bug that's so easily able to jump to others, This is why you got to knock this out.
If you're just joining us, I'm talking to Dr. Joe Servin. He joins us once a month for a house call here at WJCT. He also takes your calls and questions on any subject. So if you want to reach out to the doctor, you can call 904-549-2937. You can also email First Coast Connect at WJCT.org, or you can reach out on social media. We're talking right now about measles, the first reported case in Florida. Joe, a lot of people are seeing this as a kind of early test of this new Health and Human Services Secretary, RFK Jr., who has notably been an
Yeah.
anti-vaxxer, I think it's safe to say. He actually wrote a book about the measles called The Measles Book, and I just want to read a line from it. He says, "Measles outbreaks have been fabricated to create fear." And then he continues, leading government officials to, quote, "inflict unnecessary and risky vaccines on millions of children for the sole purpose of fattening industry profits."
That's just I have to respectfully disagree vehemently on that. This is a bug that again to tell that to the parents of the child who died because of this. This is just so heart wrenching when you see that this is so preventable. Again, this is preventable. It's not like we don't have a treatment. When the person has measles, you can't undo it at that point, but you can prevent the person from getting it, or at least minimize how severe this can get. And this is where vaccines really are the tool. And even in the state of Texas, where this outbreak, that's exactly how they're managing it. I have to give kudos to those folks, the pediatricians and other teams, because that's precisely the area. Yeah, this is happening during a change. I've seen some of the mentions where he talks about some of the folks who have it, and he encourages the vitamin A, cod liver oil.
What do
But
you think about those as prospective treatments for measles?
so on as a treatment, so once you have measles, you have measles. So as a treatment, when you have it, that's that's fine. We probably don't have too many other things to do. So strengthening your immune system with vitamin A and cod liver oil, as I think was mentioned in an interview with him, sure, because that has plenty of vitamin A. That's good to boost your immune system. There's nothing wrong in that statement. What's missing is we can prevent it. That you can get a vaccine and you don't have to have it. So that needs to be paired with the extra message: get your vaccine. This is something that has been out for a while. This is a disease we just don't need to have around at this point.
I mean, those of us who had the vaccine before vaccine
Yeah.
skepticism became such a big deal feel fairly immune. I don't know what our immunity rate is, and I also wonder for people who don't have it, is it too late to get it?
So that's a fantastic point you're making. So as adults, it depends on when you were born in terms of whether you need a booster for it. Uh, if you were born between 1957 and 1968, it's very likely that you may have gotten the vaccine for measles, which was the one dose. Now, after 1968, there was a two-dose regimen, which is really where you get
Mm.
that benefit. So if you are in that group, that may make you more likely to want to get that extra booster, if you will. But the people who really need to get the boosters that fall in that group are healthcare workers who may have the direct access to people who might have measles.
Mm.
And number two are if you're traveling in areas that a measles outbreak is occurring in. Right now, that's like a little portion of Texas. So that's if you're gonna definitely be there, be exposed, you're in health, and you were in that group, a booster may be helpful. Plus, if you're immunocompromised, if you're someone who doesn't have a good immune system.
Yeah, I wanna say we did get an email from Nancy. She said, "I was born in 1957. My husband was born in 1955, and we don't know if we've ever had a measles vaccine."
That's if you are in the if you have not, there is never too late to get it. So that's the first
Even
thing.
now, if people are
Even now,
unvaccinated.
even now, this is probably a good moment, and that's something that you can just talk to primary care. For me as a physician, one of the first things they ask is, I get even a titer, a blood test to make sure that I had like some type of measles immunity. This is something that can be quickly checked out. I'm not saying that you have to do that for all, but it is an easy thing to do. in terms of getting a vaccine or getting yourself checked, talk to the physicians. That's probably your best bet. It's a simple thing that can be just knocked out once and for all, and it is not a miserable vaccine to get.
We are enjoying a house call from Dr. Joe. We've got a question from John in St. Augustine. Good morning, John. Go ahead.
Morning. Hi. I was wondering, whenever we see a report of a child that's died of measles, that's the end of the information regarding the child. And I was wondering if you know of anything related to comorbidities of the child, their general health profile. Were they a typical, perfectly healthy child and they died of measles, or were they, overweight with other conditions, and it makes it a different context?
Yeah, John, that is a fantastic question and point you're making. In fact, it's funny you say that because I remember when I read about this child, I had the exact same question in my mind. Is this someone who is immunocompromised versus not? To our knowledge, and mind you, I'm not the physician to the child who passed away, sadly. To our knowledge, the way it's being reported out, it was a previously healthy kid who did not have, at least reported out at this moment, any type of significant comorbidities or other conditions, who happened to be unvaccinated, and that's what we know. The way measles causes problems such as, where it gets to some point like that are in two ways. First is that it can lead to pneumonia in kids. And sometimes if it's super contagious, that pneumonia is a serious condition that can lead to a fatality. The other way is if it actually affects the brain. It causes something called an encephalitis that is literally a viral infection of the brain with measles. Those are the two ways that we know of that it tends to cause something as terrible as a death. But again, I'll go back. It's preventable.
Thanks for the call, John. I want to move on, Dr. Joe, now to a study that came out that connects. We know that sleep and health are related,
Yeah,
but this was a really interesting look at how even a single all nighter can
right.
fundamentally change you at the cellular level.
Yeah, and this one got our attention, got my attention as well. We know that we've heard that people who miss sleep, who are sleep deprived, are more likely to get sick. We know it from surveys. They have more difficulty in fighting off bugs. This
And
was a
anecdotally, sure, everybody's missed sleep and then gotten sick, right?
Exactly. Like, I think about a red eye or whatever type of condition that, puts you in that situation. This was a study where they actually looked at the cells, the immune cells, a particular type, monocytes, which is the scavenger to look out if there are any bugs that are out there so it can attack it. And it occurs, and they looked at it because these cells tend to be more prominent in your sleep. Why? Because when you sleep, when you're kind of, I always think of, like, when I arrived late at night at Jacksonville Airport, everything's being cleaned and
Mhm.
everything's being ready for the next day. Well, your immune system's doing the same thing when you're sleeping, you're resting, and suddenly it's there scrubbing out any problems, any toxins, and things of that sort. This told us that if when college aged healthy individuals in the study, when they had their immune system kind of examined for this particular cell type, who were sleep deprived on purpose just to see, it reduced their ability for these cells to function at their prime, if you will, by a pretty decent number, about 20-25%. We know, if we couple it with other studies that have shown that when you lack sleep, that you increases your risk for infection by 30%. It just tells you sleep is not just important just as a nice thing to have, it's an important thing to do and prioritize for your general well-being. We're talking about measles, we're talking about infections. Guess this is what grandma or parents told you: get some sleep. There's a reason for it. Your immune system needs it.
Yeah, and they compared healthy individuals, as you said, with people who were,
Yeah,
clinically obese,
yeah,
and there had been previous studies linking obesity to some of these same immune,
that's right.
deficiencies. What did they find in terms of the healthy individuals versus the people who were, clinically obese?
What was fascinating is that those healthy individuals, when they gave them that sleep deprivation for the day, the cells acted just like the folks that are obese naturally. So that have obesity, that is. And those who are overweight, obese, that their immune system we know can be impacted. That's part of what we call the metabolic syndrome, and the cells acted similar to that, and that just told us again how the immune system just takes a hit with this lack of sleep. And it's just another reminder that we need to prioritize sleep as just as important as anything else that we do for health.
We've got a call from Mark in St. Augustine. Good morning, Mark. You're on with Dr. Joe.
Good morning. Good morning, Dr. Joe.
Hey, Mark.
I'm a nurse with 20 years experience now, and when I was at nursing school, they made us get a lot of vaccines and shots, but I don't remember if I had the measles vaccine. So, and I'm 65, I'm still working, so I'm exposed all the time probably. If I go ahead and get another measles vaccine, will that in any way hurt me, or could it hurt me, or should I just go ahead and do it?
No, I would, Mark. That's a great question. There's two things that you could do. One is, since you are in healthcare, people do draw titers, especially for healthcare workers, and that is a titer just as a way to see if you have immunity. That's a quick test. That's something that even employee health might do at where you work, because of where you work. Having said that, if you're not sure if you've gotten the vaccine, there's no harm in this one. Again, this has been around for a long time. It is fairly straightforward, and given what you do, I would suggest that it's wise to do it, because we just don't know in this regard about when there could be a measles outbreak or anything along those lines. It sounds like you have a little bit of time, but you do have a couple of options there, especially in the work that you do.
Yeah. I want to ask, we were talking about sleep deprivation. We know that it, as with obesity, that the chronic conditions associated with that can range from things like type 2 diabetes to heart disease to chronic inflammation. I wonder if you think that studies like this recent one will lead to any changes in either public health policy, or a lot of people work night shifts.
Yeah. I've had that question as someone who worked many a night shift, and my wife worked night shift as both nurse and physician, um, on that issue for a long time. I think people are beginning to appreciate this reality. I hope public policy will follow, and I'm optimistic that it will. But even in my own profession of medicine, I see that at least people are going into more shift work as opposed to going straight. So there are little small improvements. We've As we continue to do this, we will. My assumptions will continue to find that there are things that we're going to need to do to adjust to this reality to keep a workforce healthy. I don't know how this is all going to look policy wise, but I suspect there will have to be change.
Another sleep related issue that I want to ask you about, because this weekend, as
Uh,
we all maybe are aware, or perhaps some people are not yet aware, we reach daylight saving time.
Oh, and and let me just say it up front. I hate daylight savings time. I will say it very easily. And I'm going to say something political that I can't believe I'm going to do. If President Trump wants to make us all happy from an executive action, strike off daylight savings time. Just don't make us spring forward, because that'll keep us on a natural clock. And this is something I think most people would jump on. I lived in the state of Arizona for 24, 25 years. We did not do it. And I have to admit, I loved it. It was great not having to worry about that. And I think a lot of people are with me on this. I hate that springing forward, losing that hour of sleep, because as we were just talking about sleep deprivation, it does have an impact. And studies have shown that after daylight savings has been implemented, on the Monday after, there's a slight uptick in heart attacks and car accidents.
Mm.
What a surprise, because this just catches up with you.
It's interesting because there have been proposals, including here in Florida, I think, for a number of legislative sessions to get rid of the time change. But the movement is almost always towards, let's keep daylight saving in place, meaning the darker mornings and the
Right.
longer days. What does the science say about trying to switch into that mode as opposed to what we currently are in?
We know that our natural body clocks, the rhythms of our body, are very aligned to sunrise, sunset, and so the way that it aligns best is what was called standard time. Standard time is the time that we are in currently. What happens in the winter? If we keep that, it's more of a natural flow of how we manage things. What's difficult is when you jump ahead, you have sunsets that go into the 8:30 p.m. range. In some places, and I was reading Alaska, I can go into 11 p.m. Things like that start to occur, and that does it just starts playing with your rhythms, with melatonin, ability to sleep. Keeping it where we are right now is actually the more natural way of flowing with our normal body
And
clocks.
the healthiest.
Absolutely.
Yeah. I want to move to a discussion that's more political. Before we do, I got an email from Mark. He says, "No, no, no, we should not fall back." So I guess that's his position.
Okay.
Um, this study that has followed, it was in the Journal of the American Medical Association that came out looking into the medical impact of recent political decisions around abortion. So they're looking specifically at states that have gone to a 6-week abortion ban, as it's known,
Yeah.
basically limiting that window to 6 weeks. What did that study find about health outcomes for mothers and babies?
Well, to be honest with you, it's not too surprising what it found is that number one is that it increased infant mortality rate. And number two, maternal mortality rates also went up in that study. What this
Why is that not surprising?
Because if you restrict abortion, and let's say for women that are doing it for all reasons, so you restrict abortion for whatever, the let's say that if a baby has a congenital anomaly or problem, then suddenly, if you cannot have abortion on the table on in that regard, that baby will be born, and when it's born, it may not have a long enough life that they can continue, that's viable, and as a result, the mortality rate goes up. The second piece to it is that women who are more vulnerable, they're more impoverished, or they don't have access to care, or they can't leave the state where they are because of cost or money, they end up carrying the child. They may not be as healthy, they may not have access to good prenatal care, and as a result, those women are more likely to have a complication and or a problem. And that is really why we see maternal mortality go up. We see infant mortality go up. Also, fertility rate went up because that's the number of extra births, and it went up pretty big rate. But that's obvious because you're not having abortion as an element in there. One other piece I will say about this data is that it is although there were 14 states that were included because they were the ones that had the abortion bans at the time that the study was occurring. Most of these numbers really reflect the state of Texas because the state of Texas is so huge in population. All the deaths and the problems seem to emerge from that. So it's a reflection of that state carried a larger weight of the numbers of the participants in the study because they accounted for almost 90% as opposed to the other 13 states that were included in the analysis.
Yeah, and the study found that after the Dobbs decision, these bans resulted in about one additional birth for every 1,000 women. And in total, they found about 22,000
Yep.
additional births
Yep.
and 500 more deaths, infant deaths.
Yeah, and again, the vast majority of those deaths again occurred in that state. But again, whether geography or not, what it just tells us is that there are a lot of reasons why people get abortions, and when you have this one size fits all, very restrictive element, you're carrying this child, and sometimes, again, those children will not make it, if you will, and or the mom just is not because she is more vulnerable or has more complex medical conditions, there can be problems that increases those rates. If the baby survives, you increase the rate of fertility as well as the population. But on the other side of this question is that we don't know how long they survive for, and so any child that has something that may have been in a situation where they would not have made it through because of an abortion. Now they make it, and that leads us to this issue.
I wanna ask you because you talked about congenital,
Yeah,
anomalies in
yeah,
children. How when are those typically detected, in a pregnancy? If, if we know that the six-week abortion ban limits
right.
it to a six-week point.
They unless it's very severe, you're not typically doing an ultrasound till way later than 6 weeks, and so by 6 weeks, you're not going to know some of that unless it's pretty overt or obvious, and so you're getting scans and things that sort several weeks after a 6 week man, and that's why those you're going to have pregnancies that have those outcomes.
And of course, we've heard stories about people who've learned about a, congenital defect in a child, but have had to carry it to term knowing that they probably wouldn't survive.
Exactly, and that's where those numbers really impact all of this. To me, the way I took it is that this is an example. This is I did not find it surprising. This is what happens when that restriction occurs.
Is there any research into kind of what the impact is on a mother that is carrying to term a known or a likely um, unsuccessful
Yeah.
childbirth?
Yeah, I mean, I guess there's two ways to answer that. Psychologically, it can be devastating and to know that because it's just it's very very painful, no matter what from a psychological standpoint. From a physical, there are a lot of different possibilities. It just depends on the anomaly. It's hard to generalize in that type of circumstance, but suffice it to say, there are consequences that kind of emerge from this.
Well, it's a heavy subject, but I'm sure we'll be circling back as more research emerges on that. And it's great to see you, Dr. Joe. Thanks so much for being here.
And it is always a pleasure to be here with you.
What are you going to be talking about this weekend on What's Health Got to Do with It?
We are excited. We have got the CEO and president of Nemours Children's Health joining us to talk about what's going on in pediatric care. They signed a very interesting agreement in the state of Delaware, which could be a model for the rest of the country. Plus, we're talking to the president CEO of the Leon Institute. They do rankings of hospitals, but in a different way. They look to see equity and value and not just the typical U.S. News World Report element. I think it's a fascinating show this weekend.
Oh, interesting. Well, that airs, of course, at 4 o'clock every Saturday, and you can listen to the podcast at WJCT.org. Dr. Joe Servin is the host of What's Health Got to Do with It. Thanks, Dr. Joe.
Oh, such a pleasure, Ann.
All right.